Good morning. We are here today in an announcement that I know many parents in this city have been waiting for quite some time, and that is that vaccines are now available for children 5 to 11 years old in the country, and starting Monday they'll be available here in the city of Detroit. I'm going to take a minute and show you what is happening and why this is important, and then you're going to get a chance to hear from some medical experts and Dr. Vedi, who I think has done a great job in getting all of the children back in school. There's no question, it's not the same learning experience by Zoom, and the Detroit public school system has just done a terrific job. It will be so much better if the children can be vaccinated and be that much safer. But let me show you what is happening here. We are in the room named for Skylar Herbert. Skylar was the 5-year-old daughter of a Detroit police officer and a Detroit firefighter, one of the youngest victims of COVID in the United States. She had a rare side effect that caused her death. She went from a very healthy and vibrant young girl. And so here we are at Detroit Public Safety Headquarters, and this conference room is the Skylar Herbert conference room, and it's a reminder to all of us how fragile life is. And if the Skylar's parents had the vaccine available a year and a half ago, there's no doubt that they would have acted to get her protected, but we never lose sight in the city of Detroit at what's at stake on this vaccination effort. As I've been saying for months, I expected in November we would see the COVID rate in Michigan climb. And this was a time I hoped that I was wrong, but what's happening is pretty predictable. The flu season in Michigan is pretty predictable. This is what the COVID hotspot map look like in America in August. And down in the South, where people were indoors in the hot weather with the air conditioning, COVID spread rapidly. But up in the Midwest and the North, where in August we're outside, it did not. And some people thought that meant we were somehow protected. But in all the years I ran the hospital system, I knew November, December, January, people come indoors, they're breathing the indoor air, the flu spreads, and here's the way that same map looks today. It's reversed. In the South, where they're outside, the COVID spread has all but been eliminated. But up here in the Midwest, and particularly in Michigan, it is climbing right now. And as we head toward Thanksgiving, folks who are not vaccinated are going to be more and more vulnerable. And of course, we've had issues at the schools where the vaccinations were not approved for children under the ages of 12, and that's been something that I think every teacher, school administrator, and many parents in America have been waiting for. So the Pfizer vaccine, now been approved by the CDC and the FDA. It's been proven safe and effective. We got, every day, 450 children in our state are coming down with COVID. And up until now, we didn't have any way of preventing that. Starting now, we do. Because as the tests have shown over and over, the Pfizer vaccine effectively prevents your child from getting COVID. I suspect the Moderna vaccine will get approved in the coming weeks. Pfizer was just ahead of the schedule on the clinical trials in demonstrating how it worked. And on the rare cases where a vaccinated child does have a breakthrough infection, those infections have been mild. It will protect you almost surely against getting it, but if you get it, protects our children, and really adults too, from being hospitalized. And so somebody says, I got vaccinated, but I still got sick. It's possible that happens. It's extremely rare that I've been vaccinated and I'm in the hospital because your body fights it off that much faster. So the city of Detroit is now offering appointment-only child vaccine clinics for 5 to 11-year-olds. And let me tell you what we are doing. We're going to be doing this at the Health Department office at Mack and Woodward, Monday through Friday, 4 to 8. You can bring your child over after school, or at the Northwest Activity Center. We're open all day, 9 to 7, 9 to 1 on Saturdays. And when you book your appointment for the child, you'll be booked the same time 3 weeks later, because it's a 2-shot dose, and so they will take care of booking you. But we wanted to do this by appointment, because every parent knows that to take a kid into the doctor to get a shot can be a scary experience for children. And so we are setting up a separate process to make this as comfortable and reassuring for our kids. And Dr. Vedi is going to talk about what he's going to do, but we're going to continue to partner with more and more outreach efforts. Some of the details that you might not have heard about. The doses are 1/3 as big as for adults. So this is why it took so long. They had to do the clinical trial, find the right balance of what's the dose that would protect your child, but also has little chance of side effects. And so the children will get in a dose 1/3 the amount of what adults would get. They will get those doses 3 weeks apart, just like everybody else. And you can expect your child to be at full immunity 2 weeks after their second dose. So the sooner we start this, the sooner the children are protected. So, what do you need to do? A parent or legal guardian has to bring the child in. So we can't have somebody else saying, I'm getting this child vaccinated. This is a decision for the parents and legal guardians to make, and so you're going to have to accompany them to the appointment. You can call right now, same number we've been using for the last year and a half, 313-230-0505, and the child vaccine centers are going to start to be open on Monday. So you can call today and make a Monday appointment. And all the other centers are still open for the adults. This is the child center. You have to come with your child. You're going to have to sign the paperwork. You're going to have to bring your photo ID. So we want to make sure we've got protections in place so nobody calls up and says, somebody vaccinated my child and they weren't authorized. We are going to make sure a parent or legal guardian does accompany the child and that we verify it with photo ID. We are setting up separate children operations. We're going to have pediatric clinicians, nurses, and clinical staff that are experienced in dealing with children. There's going to be extra time because we want to make sure that children have time to be comfortable. The doses are going to be clearly labeled. They're going to be in separate rooms, separate environments. And the reason for the appointment is this: I don't want 14 or 15 children in a walk-in sitting around waiting and having time to build anxiety. And so you'll call up, you'll make the appointment, and your child will be able to come in, be in a comfortable environment, get their shot, be watched for 15 minutes afterwards, as is our standard protocol, and then head back out. And all of the proper procedures are in place to make sure the adult doses and the adult vaccinations are totally separate from the children's doses and the children's vaccinations. And then for everybody else, the 13 centers are still open for everybody 12 and up on a walk-in basis. And given what's happening right now with COVID in the city, if you had 2 shots and your second shot was more than 6 months ago, you should get your third shot right away. If you haven't had any shots, it's all the more urgent for you to do it. I know you've heard this over and over, but what we saw happen in Florida once, was happened in Florida this summer, was as soon as the hospital started to fill up, people started to run in to get their shots. Please don't wait. This is your last chance, as we're watching these trend lines come up, to be protected before the traditional flu season. And so that's what we are doing here overall. And with that, I am going to turn this over to our outstanding health director, who's been waiting for this day for a while, Denise Fair. Denise Fair-Razzo.
Thank you, Mr. Mayor. All right. So I am so thrilled today that we are announcing that the health department will be offering the Pfizer vaccine for children ages 5 to 11. We have been waiting a long time for this. To date, there are approximately 68,000 Detroit children who are now eligible for the vaccine, ages 5 to 11. Now, I don't have children, but I have 11 nieces and nephews. And they now have the opportunity to get vaccinated, and it gives me so much comfort knowing that they are protected and they will keep their family and friends protected. We know that the number of COVID cases remains high in children, and so until we can get more children vaccinated, until we can get more people in the city of Detroit vaccinated, these numbers will continue to increase, which is why it's so important now more than ever to take the time to get vaccinated. As the mayor mentioned, now that we're rolling out the vaccine to all sites across the city, we are taking steps to make sure that your children are protected when they come to either the health department or the Northwest Activity Center. I know the mayor already mentioned some of those safety protocols, but I wanted to take the time to just mention one of them. We are giving more time for each appointment to allow parents who may be full of anxiety taking their child to get vaccinated. Sometimes could be a traumatic experience. So we are allotting enough time for the clinicians to talk to the children, to talk to parents, to answer their questions, again, to help ease anxiety and to support them through the process. As the mayor mentioned, the vaccines are very different, the adult vaccine versus the pediatric vaccine. So we are being extremely careful. The vaccines come in 2 different containers. They are separately labeled, they're color-coded, and there are syringes designed specifically for children. So again, we do want to make sure those safety protocols are in place. And I again encourage you to give us a call right now. The lines are open to schedule your child to get their appointment. Again, that's 313-230-0505. And also, again, please avail yourselves to all of the available vaccine clinics that we have across the city, whether you want to go to a rec center or one of our churches, the TCF Center or the Northwest Activity Center. There are multiple places for you to get your vaccine. You can call and make an appointment, or you can just walk into any one of our locations. And finally, in closing, I know parents and legal guardians may have lots of questions about getting their child vaccinated. And so at the health department, we have nurses that are available Monday through Friday. You can give us a call and ask any question that may be on your mind. You can call us at 313-876-4000. You can also tune in next week on our Facebook page. We will have a couple of physicians that will be hosting a town hall on Monday and also Friday to answer all of your questions as it relates to the vaccine. We know vaccines work. There's no doubt about that. And it's our best tool to get out of this pandemic for good. So please take this opportunity to get your vaccine. And now I'm going to introduce Dr. Carla Watson. She is a pediatrician at the Children's Hospital of Michigan, and she is going to provide you with additional guidance about the vaccine. And so, Dr. Watson, you're up next.
So, my name is Dr. Carla Watson. I'm a pediatric neurologist at Children's Hospital of Michigan, and it's such an honor to be here. I'm actually a Detroit lifer. I'm born and raised in Detroit, and so it's such an honor to be able to speak to my community about something that's so important. So I really wanted to start I want you guys to remember how COVID-19 can affect kids. A lot of us, we remember that it doesn't affect them as severe or as often. However, it can. And when it does affect them, it can affect them in a very special way. There is actually a syndrome, it's called multisystem inflammatory syndrome in children. And this could be very devastating. It can affect multiple organs, and oftentimes this requires children to have hospitalization and ICU admission. Fortunately, most do well. However, the risk is death. So we must take this very seriously. I am very excited about this. I am not only a pediatrician who is currently in the hospital, and I see these cases on a daily basis, but I am a mother. I'm a mother to a 5-year-old male who has an underlying medical condition that put him at an increased risk of complications from COVID-19. So I take this very seriously. I am really looking forward to getting the vaccine for him. I want to assure you that it is very safe. We have been studying this vaccine for a very long time. And in children, fortunately, they only need a third of the dose. because their response is very robust. They produce a very effective response. And so they may still be able to contract COVID-19, but fortunately, the complications may not be as severe and they may not contract it as often. And so that not only helps them, but remember, they're carriers. They may affect us. So that helps us. That helps the entire community. So we must not take this lightly. And I also wanted to say that our kids, their social development is very important. Going to school, attending activities, football, cheerleading, that's very important for them. I just want some normalcy in our kids. Having to wear a mask, social distancing, we know is very difficult for kids. So this vaccine is very safe. We know it's very effective, and I've seen the severe complications of it. So please, I encourage everyone to really get the vaccine. We really want to return to normalcy. So I appreciate this time, and I am going to turn the table over to Dr. Vedi. He's the Detroit Public School System Superintendent. Thank you for your time.
Good morning, everyone. This is exciting news for us as a school district. Obviously, we're back in person. It's exciting to see our students back, but it's been challenging. And I commend our principals, our assistant principals, and our teachers, and our support staff. They always make it work, but they're making it work in a different type of learning environment because COVID is still a reality. This vaccine, I think, will allow us to move to the next step of this return to normalcy, whatever that means. But with that said, we will partner with the Detroit Health Department, as we have been partnering for the past almost 2 years now, with information, awareness about the vaccine. We'll also open up our schools on weekends during the school week, so that students can participate in the vaccine, and anyone who hasn't had the vaccine yet participate as well. Not only is the vaccine important because it can keep the individual children from ages 5 to 11 safer, but it keeps homes safer, it keeps family members safer when students come back to school. But in the context of learning, it allows the learning process to return to normalcy, meaning if a child is vaccinated, even if they're a close contact to someone who may be positive, they do not have to quarantine. And so that is very important in a situation where we know that our vaccination rates are still needing to improve among the adult population, but even the student population. So naturally, we will deal with positive cases, but when we are dealing with those positive cases, an individual child, if they're a close contact, does not have to quarantine. And that allows that individual child to continue normally with the learning process. I believe, and others have recognized, that DPSCD continues to be a leader in COVID safety prevention and mitigation of spread. We have been calling for universal masking before it was mandated or other districts moved in that direction. We continue to test on a weekly basis. Over 70% of our employees are vaccinated. So this is now an opportunity for us to increase that vaccination rate among our students. So again, they can go to school day to day and not worry about being quarantined or to pick up the virus for themselves or their family. So we continue to work with the Detroit Health Department and the greater community to increase our vaccination rates. Thank you.
All right, with that, we'll take any questions.
Hi, Kobe Levin with Chalkbeat. Dr. Vedi, can you provide any more details about vaccines at schools, when and where those will be available?
So we're still working out the details. Definitely weekends are going to be optimal to work around family work schedule, and the family has to be there with the child. So it'll be hard to facilitate a vaccination process during the school day and during the work week. So primarily using weekends, but we are considering a couple days during the week as well, especially as we approach the holiday. And we're working out those details as a school district and even with the Detroit Health Department.
Dr. Vedi, I had one for you also. John Hewitt, WWJ. When you talk of challenges, I know there are 4 schools right now on remote. Can you give a little more context on how they're doing? And at what point, with COVID cases coming and going, do you get a tipping point where you have to close a school down like you've done? Can you give us a little more detail?
Sure. So we try to avoid that at all means, just because it's taken us a long time to just get back to in-person learning. But at the same time, we rely on the advice of the Detroit Health Department to make those determinations. So just to give you a sense right now, since the beginning of the school year, we've had about 680 students that have tested positive, only about 133 staff, and that's because 70% of our staff is vaccinated. But the challenge is quarantining. So we've had over 3,000 students that have quarantined and about 160 staff members that have quarantined. And so when we talk about positive cases, DPSCD will talk more about positive cases because we're testing. We're the only school district that I'm aware of in the state of Michigan that is testing weekly, and that's everybody. Everyone has to test. And so we are very transparent about positive cases. By identifying the positive cases, we prevent the spread and we prevent the outbreak. So although we run 100 buildings, about 50,000 students, well over 7,000 employees, at this point we've only had 9 outbreaks. And that's extraordinary when you consider the numbers. But that's because we're testing and we're enforcing the universal masking. But to your question, yes, there are 3 schools that we shifted online learning for a couple weeks, Central, Durfee, Mumford, and Bates. And we made those determinations because through our testing process, we determined that there were multiple cases in multiple grade levels. And when that happens, that means that there may be more spread that we're trying to prevent. So individual positive cases are natural. They're going to happen. And because we test, we're going to identify those. But when we see multiple cases at one grade level, across grade levels, that leads to concern, and that's likely when we would probably move to a situation where we suspend in-person learning for anywhere from 7 to 10 days.
And just to clarify, when an individual student tests positive, they're home for 10 days, 14 days, or how's it handled?
So if they test positive, they're home for 7 days, and they can test on the 5th, 6th, or 7th day to come back the 8th. If they don't test, then they come back after 10.
Thank you. I only have one more question for either the mayor or Denise, whoever wants to take it. I believe the latest figures I saw, 47% city residents have been vaccinated. Just the overarching question we've talked about previously, especially with children, a lot of people have different concerns. Getting people to buy in, I guess, is the point, when overall we're still not at 50% with adults.
I'm not sure what your question is.
Meaning if we've always shot at 70% as the target, and we obviously haven't reached it, and I'm not trying to be half empty on the glass, but with children, I've heard people anecdotally have different concerns in regard to vaccines, let alone adults, less than half of the city residents getting the vaccination. Just wondering about, efforts to encourage as you have today, and whether you expect it to be more difficult maybe is the question with kids.
So our goal has always been 70%, and it's still 70%, and we do want to get to what we call community immunity, where 70% of the population has been vaccinated, and we know we're not there yet. In fact, when we add 68,000 kids to the denominator, we expect that number, 47%, to decrease to 42%. And our efforts are still to get the word out, to speak to people one-on-one, because residents still have questions. And at the health department, our job is to provide education so that Detroiters can make an informed decision on whether they should take the vaccine or not. We know our phones are off the hook. We are vaccinating about 800 people per day for the 3rd dose and also the booster shot. And so I imagine those numbers will continue to climb. We remain hopeful that we will see positive trends over the next several months.
Thank you. Yeah, one more for Dr. Vedi.
In terms of the quarantines that we're already seeing, how many of those are occurring in this 5 to 11 age group where the vaccine will be newly available?
Yeah, I'd have to break down those numbers. I would generally say, yeah, I'd have to break down actually the numbers. I was going to make an estimation, but I'd rather just give you back the numbers. It's across the board, but obviously our high school students are interacting more with each other than our elementary students, especially when you look at extracurricular activities. But proportionally, we have more students obviously in grades K through 8 than 9 through 12, so the numbers may be somewhat similar. But overall, we're seeing more interaction at the high school level than at the K-8. And that's to be expected because students are older. They have access to more activities and they have more freedom as older students.
All right, thank you very much. All right, so we're going to move the topic now from COVID to evictions, where we have been having enormous success, and we want to make sure that we reach those families that we may not have gotten to yet. So I'm going to show you the success we're having in the Eviction Assistance program, and then if you are facing rent arrearage, facing eviction, the city is here to help, and I want to show you exactly how. So again, we have $60 million still available to help for back rent and to prevent your eviction. We've already approved $60 million of financial assistance. We have prevented between 6,000 and 7,000 evictions. So you may read nationally about stories about eviction crises, but because the city of Detroit has been there and been on the side of our renters, it has been far less here in the city. And we are helping you in 3 ways. And if you haven't taken advantage of this, the point today is to emphasize this. First, we are providing legal representation for you in court. And I would say to the media, which has done a really nice job of helping us on this, our biggest problem is this. The lawyers are paid for you. Because you're a resident of the city of Detroit, the city of Detroit is providing you a lawyer. They'll represent you in landlord-tenant court. But if you don't answer the eviction notice you get served with the court documents and you don't answer, we can't represent you. Even if, so when you get the document, you can call us, we'll get you a lawyer right away, or the day of your hearing, if you just log on to that hearing, the city has courtroom lawyers who are representing every person that comes through. So if you just log in and make your appearance in court, you'll immediately have a city attorney representing you. So this is one of the benefits of being in the city of Detroit right now, is you have a lawyer if you're being evicted. We can do a couple of things. We have, because of the Biden administration and Governor Whitmer's efforts, back rent assistance available and potentially help on back utilities. Those programs are there. The money is there. It's meant to keep you in your home. We do not need any more vacant units in the city of Detroit. So the goal is to keep everybody in your home, and so far it's gone very well. The other piece that we have added is this. While we can help you in your back rent, if you would like to get into a good paying job quickly so that you can handle your future rent, Detroit at Work has an immediate job placement program. And I'm really pleased with the number of people that we are seeing who are saying to us, and I'm talking to the folks on the phone all the time, and people who have, normally it's not one thing that's happening in their lives. Normally there are a number of pressures that are occurring, and we can say, okay, we'll get you a lawyer. We'll help you on the back rent, clear out your arrearage. We can even help you get some repairs to your house, and we can help you get into a good paying job so you can pay off the rent in the future. We are standing behind you in this crisis. So whether you're a landlord or a tenant, you don't have to wait for eviction proceedings. We can actually help you before you ever get that notice if you're falling behind. And so you can go online at DetroitEvictionHelp.com, or you can call 866-313-2520. And again, I'd ask for the media's help. The online process is going extremely well. People who are sophisticated on the internet, they're getting online, they're getting help, it's working well. It's the folks who aren't on the internet, who need to dial this number that we're really looking to reach today. And I hope the media will help us in this to say, if you're behind in your rent, you're not on the internet, call this number and we will walk you through it and we will get you your lawyer. And the staff at Wayne Metro will help you do the process right over the phone. 7,000 families, 6,700 plus, have had their evictions prevented already. We have this down to a science. We've added more lawyers, we're adding more capacity, and we want to be there to help you. So, what if your landlord hasn't already started eviction? You can still get help. If your income is under $44,800 for a single person household, higher than that for a family of four, $64,000, and you were negatively impacted by COVID, you don't have to wait for the eviction. If you're behind in the rent, call. Call today and we will get you the help, and you don't have to get the eviction notice in the first place. We can get you back to square one. And what if my landlord has started the eviction process? Again, you start the process, call the number, you're going to have a Detroit paid for lawyer. And the key thing is you have to show up for your virtual court dates because then the lawyers will be there to help you. Almost all of the evictions that are happening today in 36th District Court, the tenant doesn't show up. That's the great majority. When the tenant shows up, in the great majority of cases, our lawyers can work it out to keep you in the house, get that landlord some back rent, and get some repairs to your house, which in many cases is a really important part of wanting to stay there. And if you are a landlord, you don't need to start the eviction process. You can come right to us, and if your tenant is behind, we'll start the process right now. And I think by now the landlords are starting to understand that the city of Detroit rental ordinance is being enforced. If you have a rental unit that does not have a certificate of compliance, 36th District Court will not allow you to evict somebody because you were illegally renting in the first place. And so I think you're going to find the 36th District Court process is not going to be friendly to you. I can't say enough about Chief Judge Bill McConico and the 36th District Court judges who have taken a strong stand to say to the landlords in this town, if your unit isn't up to code, you haven't followed the law, don't expect the court to use the law to throw somebody out. We don't want to get into this fight with the landlords. Call us. We'll get you back rent, and we'll get you some money to make some repairs so that you'll be in good standing. We're not trying to fight with anybody, but it's very exciting to see the number of repairs that are being made to houses in the city as a result of this program. Not only the tenants staying in the house, but they're staying in a house where it's being fixed up. And if you want a job, the Detroit at Work Rapid Jobs Program is great. We've got some people being placed in as little as 24 hours. There are thousands of jobs open in this city today. And you don't have to navigate the classified ads like the old days. You just come to Detroit at Work. We've got 8 centers, and if you are behind in your rent, you will jump to the top of the list of everybody that Detroit at Work is working with because we want to make sure your housing situation is stable, whether it's you or your kids. We don't want you going to sleep at night wondering if you're going to be able to stay in your place. We're going to be there to help you. So whatever you need, we'll keep promoting DetroitEvictionHelp.com or call 866-313-2520. We've spent $60 million to keep the first 7,000 families in their home. We've got another $60 million. The help is there. All you've got to do is make a phone call. And so with that, I'm going to turn it over to the CEO of Lakeshore Legal Aid, the group that has represented very successfully a huge number of our tenants, Ashley Lowe. Ashley?
Thank you, Mr. Mayor. I appreciate the opportunity to be here. Lakeshore is a law firm that provides free legal services to low-income people, seniors, and survivors of domestic violence and sexual assault throughout the whole state. And in the city of Detroit, we are so proud to be in a partnership with other legal aid programs, the United Community Housing Coalition and Michigan Legal Services, to provide representation and advice to tenants who are facing eviction. Our incredibly hardworking and dedicated staff are on every single eviction docket in the city of Detroit. So as Mayor Duggan mentioned, these are virtual hearings, these virtual dockets if you're faced with an eviction hearing. We used to walk into courthouses and go in the elevator and walk into the courtroom. That's not happening right now. Everything is virtual. So if you've been served with a notice for an eviction, you have a link on that notice that tells you how to log in. But don't worry if you don't have good bandwidth, you don't have Wi-Fi, or you don't have a Zoom capability. You can still use your phone to log into the Zoom call and participate just fine. When you get to the courthouse in that virtual hearing, the judge asks the tenant, do you want to talk to a lawyer? There's a free lawyer here for you. And if they do, they're placed into a Zoom waiting room. And what that means, it's a separate space on the Zoom call that is private for the tenant and the lawyer. So nobody can hear, the judge can't hear what's going on, and the landlord can't hear what's going on. And the tenant has the opportunity to ask questions and explain what's going on to the lawyer. So the lawyer will listen to the tenant, find out the situation, and then give some advice. And we're always giving advice about the rental assistance programs that are available. As Mayor Duggan made very clear, there are funds available to help tenants. It's back rent, it's future rent, it's utilities, and even an internet stipend. So there is money available, you just have to apply. And anybody who is behind in their rent should be applying. You don't have to have that eviction notice, you don't even have to have a notification from your landlord that you were behind. You just need to either go online or make that phone call to start the process. And it's relatively simple. You just need a few pieces of proof. If you have a lease, get it. If you have notice, proof that you're behind in your rent, have that. Proof of your income. Very simple, and that'll get you started. And if you need help, you can call the phone number and someone will walk you through that application process. Also, and this is critical, if you are served with a notice to appear at one of those Zoom eviction hearings, you must appear. Legal aid attorneys are doing great work and they're providing a lot of services, but we can't do anything unless you appear in that court so that we can talk with you. And so some things that we advise on, if you have subsidized housing, maybe you have a housing voucher, Section 8, there are special rules that apply, special protections, and the legal aid attorneys can help advise you about that and enforce those rights. Also repairs. Everybody has a right to live in a safe space. And if you need repairs, that's something that the legal aid attorney can help with. And advise tenants that you can't be penalized for asking for those repairs or even asking for an inspection. So know that legal aid attorneys are on each of those dockets and ready to help tenants stay in their homes. And at this point, I'm thrilled to introduce one of those tenants who needed some assistance in staying in her home, and that is Ms. Janice Pemberton.
Thank you very much. I want to thank Mayor Duggan, Corey, and Chelsea for calling for me to come down. I appreciate it. My name is Janice Pemberton. I live on the east side of Detroit. I've been in Detroit since since 66. So I got behind in my rent because I had a roommate, but when he passed, I fell behind. And I called my landlord, and he came over, and we had a talk, and he introduced me to this program. So I called, and I did what they asked me to do. But I have a jewel of a landlord. He never evicted me. He never told me I had to move. He worked with me. When he came to pick up my rent, he took what I had, and he never asked me, when you going to have this, when you going to have that. But he really is a good guy, and I really love him for letting me live in my home because I have a handicapped daughter. She had a stroke, and so she lives with me. She had a stroke at work. She had 3 strokes, really, but the last one was real detrimental. And I appreciate Mel Duggan for having this program and introducing and helping me, and I thank God that I didn't have to move or whatever. And I really appreciate this program. And it's so many people that need help, but they don't know how to reach out for it. And I am so glad that I was here to speak. If they are listening, whoever needs help, I advise them to go into the SERA program and get help. And I appreciate that, and thank you all for having me.
That was fantastic. Thank you. And so, Ms. Pemberton, I think, did a beautiful job. We have nearly 7,000 people like Ms. Pemberton. Everybody has an individual story. People were hit hard in this crisis, and we're there to stand by you and to help. And we will help you just as we help Ms. Pemberton. Thank you so much for telling that story, and we'll take any questions now on the housing issue.
Yeah, Mayor, I just wanted to know, you said 6,700 with the first round of money, and now you have another 60 million. Do you anticipate similar numbers, and/or how do you characterize the need as far as how many households are out there, in this situation?
Well, what's happening is this, that for a long time, the 36th District Court had a moratorium on the final writ of eviction. And so there weren't a lot of people actually being forced out of their homes. That's been lifted in recent months, and the court dockets are picking up, which means even though you might have felt comfortable 3 months ago, 4 months ago, it's likely the process is working against you. And so we're just trying to get out the word that the evictions are real in moving through 36th District Court. And if you have one of the city lawyers representing you, or you call Wayne Metro, we're having an extremely high success rate in keeping you in your home. So really, the point of pushing this out now is that as the court dockets open up, it's that much more important for you to make sure you respond to your pleading, call us, and we'll keep you in your house.
And the only other question I had on this topic, and I don't know frankly if there's a clean answer, but how much time are you buying people? And by that I mean, I know every situation's different, but people come into this situation, and if they get a situation resolved where they're not evicted in the short term, are you finding that this will hopefully
I'm
set
going
them
to
up?
ask Julie Schneider or Chelsea Neblett, one of our program experts, to answer the question on exactly how long this lasts.
Good morning. I'm Julie Schneider. I'm the Director of the Housing and Revitalization Department. We expect the program to be available until late next year, at least based on the U.S. Treasury program. As far as how much assistance we're able to provide through this program, we're also able to provide 3 months of forward-looking rental assistance. So if we've served at a time, so if we've served a household previously with arrears, and for whatever reason, they're still facing that COVID-19 hardship and still having difficulty paying rent, we are able to provide 3 months of forward-looking rental assistance. Mayor Duggan also talked about the Rapid Jobs Program, so we're really trying a wraparound approach with this work, not only to make sure that we have the forward-looking rental assistance available for people that need it, but also if they are needing employment, that we're able to provide that quickly too, to resolve the issue for households on a long-term basis.
Thank you.
Anything else? Or whatever. If you want to ask it, go ahead.
Since nobody else, I have one off-topic, Mayor, and that was the news this week out of the City Council meeting Wednesday, where Inspector General Aha mentioned she's at an impasse with Corporate Counsel Garcia, has appealed to the Attorney Grievance Commission. I don't know what thought you have on the impasse, and what she laid out the other day is feeling Corporate Counsel is working in defense, if you will, of employees perhaps under investigation.
The Corporation Counsel is providing legal representation to our employees, as they should be. The 2012 City Charter created the Office of Inspector General, and it gave the Inspector General the power to compel city employees to come in and be questioned, to place them under oath, and it puts the employee under threat of prosecution for perjury if they make a mistake. That same charter said that the Corporation Counsel can provide legal representation to employees on those procedures if it involves their job. That is, you don't force your public servants to go in without legal protection. Last year, the state of Michigan addressed this. Public Act 357 that was passed by the state legislature explicitly says government agencies may furnish legal services to employees who are called in to investigation. Because think about this, public servants don't make that much money. If you've got to spend thousands of dollars on a private lawyer every time you're called in, who would want to work for government? So the state law explicitly says the Corporation Council can provide representation. The charter says the Corporation Council can provide representation. We've had employees who have gone through the Federal Inspector General, to the Michigan Attorney General, to the Michigan State Police, with city lawyers with them, and nobody objected. I have no idea why the Detroit Inspector General is trying to deny people their statutory right to counsel. And that's all that Mr. Garcia is saying is, if an employee gets called in, that's good, that's the Inspector General's role. We're going to make sure that employee has an attorney to protect their rights. And I would say to you, if you went into questioning and you were under threat of perjury and prosecution if you made a mistake, you probably want a lawyer with you too. And so I think Mr. Garcia is right. I have absolutely no idea what the Inspector General's basis is to try to deny employees the right to counsel.
Thank you.
All right, anything else? Thank you all very much.